I'm David Blaine, a GP Senior Clinical Lecturer here in General Practice and Primary Care. Really pleased to welcome for this session, which is part of our Research and Development Skills Seminar Series. The session today is about research integrity, and we've got Professor Kathleen Boyd and Professor Peter McPherson. So hand over to you both.
Thank you very much. Before I start, can I just check with everybody online? I think I've shared my screen and I think you can hear me. Is that right? Can I get somebody to either give you an audio yes or a yes? Okay, thank you for letting me know that. Hi, so yeah, and thank you for the introduction, David. So I have been asked to give this today because I'm for those of you who don't know, I'm the Research Integrity Advisor for the School of Health and Wellbeing, and my colleague Peter McPherson is also Deputy Research Integrity Advisor. There's Research Integrity Advisors, one for each school, and then there's a Research Champion who oversees research integrity issues for the whole of MVLS. And I've got lots of links to all the online stuff for you today about that. What I'm going to do as well before I dive in is disclosures, because it would be very good to give research integrity lecture and not acknowledge the people who helped me put this together. So I wanted to acknowledge the Research Integrity Core team at the University of Glasgow, in particular Amanda McKenna, Samantha Oakley, some of you might be familiar with her name. She develops the Research Integrity Moodle online course, and Eleanor Toland, who does a lot of, she's another Research Integrity Advisor. She does a lot of stuff in terms of authorship as well. So thank you to them for helping with the slides to put this together for today. So I'm going to just quickly, for some of you may be really familiar with research integrity, some of you may not. At our annual away days, we quite often have a research integrity session. We didn't have one this year, but in previous years we've had the champions from MVLS come and give an overview. So some of you may be familiar, and you should be, because when you join as a PGR student and as a member of staff, we have research integrity online training. But I'm going to go over just a wee bit of what that is. The University of Glasgow Code of Practice. I'm going to talk a bit more about misconduct. I mean, it's such a huge issue, and I did put out feelers to see if there was anything of particular interest that people wanted me to focus on today, but I didn't get anything. But what I do know is that there's key misconduct issues that are relevant to MVLS, and some that are more specific things that we see within SHW more commonly, and also some authorship stuff, so I've focused on that. And then once I've finished talking, Peter is going to give us some examples of research integrity dispute, and actually the kind of formal process, and I'll talk to you as well. We can have research integrity issues quite often, and we prefer, and in most cases they do get resolved informally, but there is a formal process for misconduct complaints and issues, and so Peter will talk you through an example of one of those, which is anonymised and actually from a different university, just to make sure that there's nothing from SHW. And then he's also going to give us some insights. So he's an editor at PLOS Medicine, and there's a lot of research integrity, especially and authorship issues there. So Peter's going to talk us through some of those. So, it's not doing this. There we go. So what is research integrity? Well, it's essentially good research practice. And essentially what research integrity is wanting to do is to ensure that we have trust and confidence in all aspects of research. So research integrity isn't just relevant for one specific discipline, it's for all disciplines and for all sectors, and essentially covers the whole life cycle from basically the initial idea and the conception of it, right through to the design, the undertaking of the research, and inclusive of the dissemination practices as well. So it covers the whole life cycle of research. It's not just relevant to one specific bit, or as quite often we see in the examples from MVLS, is like a lab thing and manipulating data in a lab. It's relevant to the whole of the life cycle and across all disciplines. Oops. Need a clicker. This is from the UK ROI, the Research Integrity Office, UK. They have a huge wealth of resources online as well for anybody who's really interested. They do loads of free webinars and seminars as well. There's a big UK ROI conference. That's just a wee side to let you know, and I've put the web link up there for them. But essentially, they've identified 5 core contributors or areas for research integrity. First one being honesty. It's about honesty in all aspects of the research. And as you can see, they're planning, methods, data collection. So essentially that's being honest about what your initial plan, what the initial idea is, and what you're trying to find out as well, right at the beginning, and being clear about that, right through to how you then are honest in the methods that you're going to undertake, the way that you do data collection and the way that you store it, and being honest about that. Credit there is about authorship and reporting, and acknowledging people who have contributed to it and others who, and how you're going to do things, and then reporting and interpretation of it. The next area is rigour, and that's essentially saying you're doing this to the best methodological practice that you can within your area. So following the appropriate methods, not just following protocols, but developing protocols in advance and then sticking to them. And then if there is deviations from it, again, going back to the honesty, reporting that and explaining that clearly to your contributors, to your stakeholders, to your funders, and in your dissemination. So it's about developing good research practices and rigour right throughout the life cycle as well, and how you interpret data and then drawing your conclusions and disseminating them. Next one is transparency. So that's, again, a lot of these essentially make sense when I talk them through, when you think about them. But when you're actually undertaking research and you've got stressful deadlines and lots going on, a lot of this is easy to kind of forget. So it's about promoting trust and confidence. And again, that's in, for example, reporting the full methods that you've got and publishing all results. So not being selective in your results. Are you actually, publishing something that is just looks really that wasn't actually in your initial protocol, but as a sub-analysis that you've done, a subgroup analysis, because you've actually found something great there, rather than actually reporting all your publications. Likewise, all your results. Likewise, for example, if you're not getting the results that you want, or you don't find the effect that you want, just not reporting that, but reporting other things. So it's about being transparent and promoting trust and confidence in the research that you've done. And then declaring conflicts of interest. As you can see, there's multiple points under all of these. Respect basically essentially covers everyone and everything involved in the research. So that's your colleagues, your collaborators, the other researchers, your junior researchers, your more senior researchers, but also all the participants. And this covers, as you see, all disciplines, so animals and the environment. But for example, what about your participants and feeding back to them? Well, we say, we'll tell you the results at the end, but do we actually then take the time and dissemination to invite them back to a stakeholder workshop, to disseminate properly to them, to the PPI people who are maybe involved right at the beginning of the grant application? Do we actually respect and ensure that everybody's included if they want to do so, and if they want to, in terms of disseminating that back to them? And then accountability. So everybody should be involved and accountable, and to create, essentially about creating a research environment where everybody is accountable for themselves, but also collectively. So for example, with the funders, the research institutions and the publishers. So if you click on this, you can find out lots more about this and examples of what it means, like tangible examples of each of these things. Whoops. So what is research integrity at University of Glasgow? Well, as I said, it's good research practice, and essentially it's underpinned by the Code of Good Research Practice. Has anybody in this room heard of it before? The University of Glasgow Code of Good Research Practice. I've seen a couple of nods, but not many. A lot of people who get in touch with me just for advice. So some people get in touch with me when there's formal issues that need to be followed up, some issues that can be followed up informally, but also just for advice. And a lot of people don't know this exists, despite the fact that it is publicised really clearly on the university website. There's a link there to the PDF, but there's also an interactive thing through the website where you can click into different bits of it. And essentially, it's a code of good research practice that underlies everything that's relevant. And it's relevant for everybody. It's not just for professors, and it's not just for researchers. It's for PGR students. It's for visiting researchers. It's for anybody we're working with and collaborating with, as well as industry partners, that we all have to abide by this code of good research practice, essentially. And what this is taken from the website to show you, we're committed to providing an environment that recognises and supports research that's conducted at the highest academic rigour, but also of quality, but also trust comes in here again, trust and transparency. And research integrity actually covers a huge amount of things, which is why when I was first asked to do this, I said, is there any specific issues that people want to focus on? So as you can hear, there's a whole big list. If you go into the Code of Good Practice links at the university, and there's an overview of all the principles, but there's lots of different areas of conduct, of good conduct, which can then lead to misconduct, which we can talk about in a few minutes. So, for example, the most obvious ones are plagiarism and even self-plagiarism. What is that? How do you know if you're self-plagiarising yourself? And I've had to give advice on this over the last few years, and it's not always clear cut. It's not always easy to know. What if you published a methods guidance or a chapter a few years ago and then you're updating it? How do you know how much you have to self-cite yourself? What is new? What's not new? And it's actually about having a transparent discussion with the publisher, with your research team, and with yourself about trying to identify what elements are new, what elements aren't new. And a lot of this can be a grey area. So it's really useful to have the Code of Good Practice and the specific research integrity advisors at the RI core team here, as well as open, transparent discussions with editors, journal editors and book editors. Image manipulation, publication authorship, intellectual property advice, data management, open research, then collaboration. So there's a whole host of areas of conduct, and I'm not going to go through each and every one of them, but just wanted to highlight them for you. I'm not going to dwell a huge amount on this, but it's just again to raise it because I suspect a lot of people may not even be familiar with this, that we have at the University of Glasgow a researcher concordat group, and we have the Research Concordat, which is essentially an agreement to improve employment and support for researchers and researcher careers in higher education. So this is a UK level thing. This is just a timeline of how it's developed. And back in 2020, University of Glasgow signed up and we created our own action plan for this, which was from 2020 to 23. And they now have a group who's going to develop a new action plan, an updated action plan. So as part of that, what it covers is kind of beyond research integrity, but includes it. And so I just wanted to flag some of these wider areas to you as well, because some of you may be interested in getting involved with this and with this group. So we essentially have the principles of the Research Concordat, which is about environmental culture, employment, professional career development, as well as wider stakeholders with funders, institutions, managers. And what the Research Concordat does is it deals with a whole host of things. For example, lots of issues that affect ECRs, your academic career progression. Contracts is one of the things that was in the old action plan and is again probably going to be in the new action plan, trying to get more sustainable contracts for researchers who are always on not permanent contracts is a big issue. Training, for example, the early career development programme at University of Glasgow, what the group is trying to look at now is more consistency, have access to this not just for those in an academic core funded post, but is there interest for researchers beyond on rolling contracts, for example, to get access to the ECDP training. And what essentially they're wanting is to get consistency. They want to try and figure out what's happening in the different schools, in the different units, and then in the different colleges, because there's inconsistencies happening. And so what they're trying to do is develop an action plan to ensure more consistency and support and to continue on improving. So just to let you know that. And there's a new Concordat group at the University of Glasgow. Within MBLS, we have a new group which is including all the heads of directors, the directors of research, so myself and the other directors of research in each of the other 6 schools in MBLS. And it's chaired by the Concordat lead and the head of research culture, Kate Gokoni and her team. And there's a new person in place, Dr. Rhoda Stefanatos. So if anybody is interested in all this, and they do need ECR reps, if anybody's interested in all this, come and have a chat with me, because we really don't have enough ECR reps on all these different groups. And I know we have a lot of ECR things going on within SHW, but for example, I don't know if you guys are if anybody in the ECR group is in contact with NERD, which is an MVLS ECR group. So it'd be really good to make sure that we're getting good representation from SHW into these things as they're developed, as the action plans are developed. So I just wanted to highlight that to people, because I do think that this correlates in with research integrity. Again, another slide. I think this was put up at our away day, but many of you may not be aware of the University of Glasgow values, which should be underpinned in all of our research and our research practices. So the values were, they did a university-wide consultation process in 2019 and 2020. And so this was developed with research staff, PPS staff, PGR students. It was a broad range. People contributed to this. And these are the 4 key values that our research should stand by. So ambitions and excellence, curiosity and discovery, integrity and truth. So that really underpins research integrity, which is essentially not just doing the right thing, but doing the right thing, not just the easy thing. So that really sticks to a lot of the stuff that I'm going to talk about, where it's like standing up. If there's areas of misconduct and things that you see happening, even if you aren't able to or don't feel you're able to voice that concern directly to the people, you can voice it to other people and raise issues of misconduct and mispractice that you think aren't appropriate. So yeah, so I just wanted to give the link to the university values. So what is misconduct? In the University of Glasgow policy, we characterise it as behaviours or actions that fall short of standards of ethics, research and scholarship required to ensure the integrity of research is upheld. So What does this mean in practical terms? As I've said before, and I want to reiterate, this is for everybody at University of Glasgow who's involved. It's absolutely important for PGR students as well as for staff. It's also important with our collaborations with industry and our collaborations with other institutes that we uphold our values and that we're transparent and raise issues that we think are not aligned with what our good practices. So what are the big three misconduct issues that we see in practice? Fabrication. So that's essentially making up results. And you might think that's nonsense. Well, is it really? It does happen. It happens all the time. And there's lots of cases seen at MBLS of this, where it's making up results in a lab, making up results from a qualitative survey. Fabrication does and can happen. Falsification is manipulating results or not reporting your full results to make false claims. So again, it might not be changing digits or changing your actual results, but what it might actually be is not reporting the primary outcome, for example, which wasn't really what you wanted to see, and reporting some of the secondary analyses. So that not full reporting and not full disclosure can be falsification. And the other big one that we see is plagiarism. And I'm conscious of my time. I wanted to give a kind of example. There's different examples that we see of plagiarism. I talked a little bit about self-plagiarism, and I've over the last few years had given some advice to people with regards to self-plagiarism. But I've also seen cases where, for example, a third year, fourth year PhD student actually found a systematic review that they had done and published was published elsewhere as well by somebody else at a different university internationally. And what did they do about that? Well, first of all, they contacted their supervisor. They then marked up the document that they'd seen that actually had clauses and lots of very similar stuff that they had done. And then they contacted me. I raised it with Amanda McKenna. I thought it was definitely a case of plagiarism. We checked it with the RI core team, Amanda McKenna, and then what we did was they got in touch with the journal and with the person and with the institution from which that person came to and raised this, and then they've got these marked up documents. If there any dispute follows that, things can get escalated at the university level. So this was resolved. The article was retracted from that other journal, but this was a huge stressful thing for this final year PhD student who already has this one publication, but it can completely undermine their research. So I just want to give you might think this doesn't happen, but it does, and it happens quite frequently. So it's a very serious issue, and it's taken very seriously. Other research misconduct examples. So for example, if you've got failure to meet legal guidelines or obligations, ethical, professional obligations may have been if you overlook those or don't fully disclose things. Misrepresentation of data, as I said, kind of that falsification line. Different people's involvements, not fully disclosing any potential conflicts of interest, falsification of, for example, your qualifications or publication history, making things up just to make your CV look better. All these things that actually you might not think are serious things, and I've just done this as an example, I've just done this. Lots of silly things that people do. It doesn't mean that somebody's a nasty person. A lot of people do things not realising the seriousness of some of these misconduct practices that they're undertaking. An improper way of dealing with allegations of misconduct. So, for example, if somebody came to me and told me about a concern they had, and then I just didn't bother dealing with it, and I said, oh no, I know that, their supervisor, that's fine. That would be misconduct. That would be not dealing with it, not taking it seriously. So, improper dealing with allegations. And the consequences of this, well, as we know, huge impact on the person who it's happening to. So the example that I gave earlier of a final year PhD student, huge stress on their lives, but also an impact on potentially their future career. Reputational damage for the university as well, or for the unit and the university, and reputational damage for individuals in their careers. So it's got to be taken very seriously. So why do people do it? Well, lots and lots and lots of reasons. Pressure to publish, pressure to get your publication out, have positive results so you can get a publication. Pressure to bring future funding. If you've got good results, you might be able to get more good funding. Pressure from industry partners. Your own personal plans for career advancement. And I think these last two are some of the main reasons, to be honest. I mean, I can see some of these especially in lab-based work, but here, lack of supervision, inadequate training, lack of advice and proper conduct advice from supervisors, and poor research culture. I mean, we actually do have a very good research culture here in SHW, but as we've talked about and as we've seen at the away day, there's always room for improvement. So how is this relevant to you? Well, you know, a lot of people focus on the bullying and hierarchy, but for me, I think, and the cases that I've seen and the cases that I've heard from as well from other people, is actually quite often to do with a lack of transparency and a lack of expectation setting, especially with authorship. I think transparency and expectations with your team, with your research group, with your wider project team and collaborators, this is a key reason for these things happening. And this is just to give you a flavour of some more examples. So supervisors claiming authorship on academic papers, whether that be the supervisor themselves pushing themselves onto it just because they supervise you, even though they've had nothing to do with this particular piece of research you're doing, or it may well be, which I've seen before as well, is more junior researchers putting or asking at the last minute a big wig academic on their paper so that the paper gets a bit more credence, and just slipping them in at the last minute on their paper. Intimidating, or maybe that's too strong a word, encouraging staff to leave out part of the data set to make the results look more favourable. So again, this falls under that falsification one that I said earlier on, when actually it may not be really straightforward and really transparent that somebody's falsifying data, but it may well be, oh, well, we'll report this and how are we going to frame this paper? And it may well be that over the course of a discussion with lots of different collaborators that actually some of the key messages and key things fall out because that's not really what we want, the story we want to tell. So it may not be as strong as somebody being intimidated, but there's lots of different ways that these kind of incidents and examples of misconduct can slip in without maybe you or the group actually intending it to happen, but it can happen. People taking credit for work that's not their own, and then staff under undue stress and pressure to falsify results or to get results written up really fast for a funder deadline, and then things being misreported by accident, errors being made, things not being proofread properly, decimal points being put in the wrong place by accident and then getting published. So if there is misconduct issues, if there's any areas of concern you have, what do you do about it? Well, first of all, there's a whole host of resources available on the website, on the University of Glasgow website. There's forms, there's anonymous forms and unanonymised forms to report things that you see. There's also dignity at work guidance within SHW. Your first point of contact if you want any advice or have any concerns, come and see myself or Peter. We also have, and I've got a slide in a minute detailing who they are, we also have an SHW safe person or safe allies, which goes beyond research integrity, but if you have any research integrity issues, you can go and talk to them either for advice or for advice on who to see or how to escalate things or how to deal with a situation. It doesn't have to be a big formal complaint. Essentially, we want to be able to, we want an environment where people can come and talk to somebody, because we know that quite often misconduct issues or concerns you have may be either directly related to a supervisor or a colleague, or somebody within your research unit or group that you work closely with, or it may well even be with academics in a different university. Oh, don't know what's happening now. May well be with academics in another university who are more senior to you, but you're the senior representative from the University of Glasgow and you don't know how to deal with it. Come and speak to us, and that's why we've got myself and the safe allies across SHW, who are across all the different units, and SHW as well, for you to speak to completely in confidence. We also have the University of Glasgow. You can either contact Amanda McKenna's team directly, or you can go through the University of Glasgow Integrity inbox. And there's also an online anonymised form, which is in the UOG help desk, but the link is readily available on the main research integrity web pages, which is basically an anonymised reporting form. Obviously, that is the least helpful option, because then nobody can get back in contact with you. But if there is an issue that you feel needs to be reported or flagged up that this is happening, but you don't want in any way it to be connected back to you or your research team, you can use that. But there's only so much that the university can do is if you report something through that method. So what do we do when there is an allegation? Well, we assess the allegation and determine the best approach to remedy it. So, for example, I will see if somebody approaches me with something, is it just some advice I can give them? And quite often, even if it is just advice, I will maybe drop Amanda McKenna and her team a line as well to see if there's any additional advice. They'll say, this is completely anonymous, obviously. This is the situation. This is the advice I've given. Is there any other resources or any other advice? Because that's their full-time job. Research integrity advisor is not my full-time job, so they quite often do know other things. Likewise, if there's a situation, I can discuss it with them. I can discuss it with Does it need discussed with the head of school? Is it something that can be resolved informally? Is it something that can be resolved through communication? Or is it actually something that somebody needs formal training on? And it may well be an informal resolution and additional training, either for the whole school or for the particular people involved. Or does it need a formal investigation? Or and then dismiss the allegation? Well, we would never just dismiss it out of hand. We would dismiss it once the allegation has been assessed and explored. Peter is going to give an example actually of a misconduct process as well. But essentially there's 3 stages to the process. Receipt of the allegation, we have a responsibility to, sorry, I don't know what to have. It's because I don't have a clicker, I'm having to scroll. So we have, within receipt of the allegation, we need to respond within 20 days. There may be an initial investigation. This must be on timer. There can be an initial investigation stage, which has to deal with 60 days. And if it goes to a formal investigation, which means it will go to Senate, the case of both sides will need to be put forward, then there's no time limit on that. And it may be a long, lengthy process. But that doesn't mean that it's not necessary. And in some cases it is necessary. In a lot of cases, it can be resolved informally and at the school level. Okay, so this clearly wants me to move on to authorship now. So I thought I would put together a few slides, mostly because authorship disputes, authorship queries and advice comes up time and time again. And I know that my colleague, I've got a slide on it later on, my colleague Francesco Manca from HITA, he's one of the ECRs and SHW. He's been working with the research integrity team, exploring authorship issues, exploring perceptions amongst staff within SHW on what authorship is and what people's understandings of the authorship guidelines are. So what is authorship at the University of Glasgow? Well, actually, it's really strict. The criteria for if somebody is to be a co-author on a publication, each of these 4 points, as you see, there's an and. So somebody should make a substantial contribution to the conception or design of the work, or the acquisition, analysis, or interpretation of the data, and draft the work and or revise it critically, not just a last minute revision of a fully formed, ready to submit document. And they should have revised it for important intellectual content and have a final approval of the version to be published and agreement to be accountable for all aspects of the work and ensuring that questions related to the accuracy and integrity. So for those of you who have been a co-author, when you submit something, it might be very easy to just agree without really thinking, have you actually contributed substantially to all these aspects? The reason the university states these definitions is this aligns with the ICMGE definition. So a lot of you will be familiar. I always say the acronym wrong, so I'm really glad I've got it spelled out here properly. The International Committee of Medical Journal Editors. So these are their recommendations for what a co-author should have. Yeah. So I was just wondering how much time I should spend talking about this. So, for example, if you were a co-applicant on a grant and got the initial help to secure the initial funding, and then you, for example, like myself, are a health economist, and say you weren't involved in the qualitative analysis of it, just because I was a co-applicant, should I therefore be on the qualitative papers? Sorry, I'm a health economist. So this is my example. I'm a co-applicant on the funding. And the qualitative, I knew that qualitative work was going on alongside the project, and then they've written up the qualitative paper at the end. Should I be a co-author on their paper? Likewise, should they be a co-author on my health economics paper? Well, if I don't fit all those 4, according to the university guidelines, no. But what's our definition of substantial contributions? The conception of the design. What is substantial contribution? How much do we know that I was involved in revising or drafting or revising the work critically? So a lot of this actually can be open to interpretation. And the thing that I would say is, so this is quite strong, but actually different groups work differently. And the key thing I think with authorship is having transparency and setting up, for example, a publication plan or a publication clause or agreement with the whole project team in advance, because you might have international collaborations. It might be a huge big project group. Should 25 people be on every single application, every single paper, or actually should it just be the 3 or 4 core people of the team? But just keeping it to 3 or 4 core people who wrote that specific paper might not be adequately acknowledging other people. So I think for me the key thing is about transparency and transparency and clarity on what you are. And one of the really helpful things is this statement credit. I don't know if anybody's here is familiar with credit, the 14 contributor roles. So credit is essentially a taxonomy that has been created, including 14 key roles that can be used to represent or show what you have contributed to a research output. And I've put the links up here. And myself and the university highly recommend that you use these. So here's the 14 roles here. And if you go into credit, there's a definition for each and every single one of these. So conceptualization, data curation, formal analysis, methodology, visualization, writing the original draft, or writing, reviewing and editing. So you could have actually done 2 or 3 of these, but still not necessarily fulfilled the four main criteria of the ICMGE criteria. So as I said, it can be a bit of a grey area, but what is really useful about this credit is it means that everybody's able to be clearly and transparently acknowledged for what they have contributed to that paper or to that piece of work. So the benefits of using it, well, it meets the code of good practice for us, for their university code of good practice. It enables fairness and transparency. It aligns with good research and helps in decision making. It can help avoid authorship disputes, or help realise when somebody says, hey, wait a minute, you can use it for yourself. If you're like, hey, wait a minute, I've not been put in this paper, but I did this data analysis, but I also did this and this, and I feel I want to be able to contribute. What if that person hasn't done it because they just weren't invited to read the first draft, and they just weren't invited to review the final draft? That doesn't mean that they shouldn't have been an author. Maybe they weren't given that opportunity. So it's about enabling a transparent and open discussion with the research group. And actually for future ref as well, as Director of Research, I'm part of the ref scoring group for SHW, and we do look at the credit when, especially there's a lot of papers where, especially in very high impact journals, where there might be 12, 13, 14, 15 plus authors on it. So we look specifically for contributor statements to see, well, where are the people from University of Glasgow, what did they actually contribute to this? So it's really important for ref as well, and for thinking about how our outputs as University of Glasgow staff and PGR students are valued. Okay, so I won't dwell on that anymore. So just in general, some recommendations. It's about having a discussion early in the project. As I said, it's about, even if the PI hasn't mentioned it, maybe you can mention it and say, while we're thinking about all the various, because there'll probably be a discussion at some stage about a publication plan, how are we going to say who's included, what decisions are going to be made? Because a lot of these decisions will be made ad hoc along the route, and it's much more transparent if we have a discussion and a general agreement earlier on in the project. There's also an app called the Tenzing app that I hadn't been aware of before, which basically essentially maps the credit roles and reviews, so it helps you record them and it auto-generates things. So if you just Google Tenzing, it comes up. Yep. So you can also have formal written agreements from all involved about what's going to happen. But again, that's likely to happen at the beginning of study with all the co-applicants, possibly before the researchers who are going to be undertaking the actual work and possibly drafting the first drafts of the papers are part of the team. So again, if it is a formal written agreement, have all the researchers and people who are going to be involved in the work actually contributed to that. Document decisions, have a decision log as things go along to remind yourselves of what was agreed and when. And contributor statements added during the submission. Even if the publisher hasn't requested it, I quite often suggest to my team, I'm like, can we have contributor statements? Because I know it's going to be really important for ref, but it's also really important for other researchers, part of the team. It's really important for their careers, for people to have these contributor statements. So even if it's not in the journal mandatory guidelines, it's still something that can be raised and discussed and added. So I just wanted to say the work on authorship that Francesco and the Research Integrity team have been doing, they've developed a survey, and so that's going to be coming soon, probably in August. And SHW, again, we're kind of Athena Swan Gold, and we are a bit ahead of the curve compared to a lot of the other schools. That doesn't mean that we're perfect, and it doesn't mean that there's sorry. So there's going to be a pilot in SHW, so just to flag that. I know we all get a bit of survey burnout here in SHW, but keep your eyes open, there will be an authorship survey coming soon. And I'm going to pass over to Peter now to talk through some examples.
Thanks, Kathleen. Good. So hi, everyone. Good afternoon. So I'm Peter McPherson. I'm a Professor of Global Public Health here in the School of Health and Wellbeing. And I'm going to talk through 2 examples of research integrity investigations, really, that I've been involved in. And something that I've been involved in for quite a long time throughout my career, and been very fortunate to have a couple of roles where I've had to deal day to day with research integrity issues. First was where I held the role as a research integrity officer in my previous job. And secondly, I'm an academic editor at the journal PLOS Medicine, and we deal with a lot of research integrity issues. You would be amazed. And what I would say kind of as a high level message first is that nobody thinks that they will be involved in research integrity issues until it happens. So it's kind of like, yeah, this is a problem, but, you know, whatever, it sounds very difficult. There's surveys coming around. Don't need to think about it right now until, bang, you're stuck in the middle of an investigation. So my sort of message would be, these things, don't run away from them and hide about them. Think about them. Like Kathleen said, if you're planning a new project or a new paper, think about what the consequences of authorship might be. If you're thinking about some new experiments in the lab or some new data collection, be rigorous, write a protocol, write a plan, document everything. And then if the worst does happen and you get involved in an investigation, you're very clear that you've done the best that you can do. And I absolutely agree with Kathleen's point. You know, at the heart of this is the university's principles around research, and this is being honest to yourself as a scientist. There is no point, there's all of these incentives to cut corners and to fabricate data or to falsify data, or to even get yourself out of papers to advance your career. But what that really does is it sets back science in quite some considerable way. And I'll show you some direct examples of where that's happening in the next few slides. So it's like that thing, I don't know, the quote about how did you go bankrupt? Well, I lost a little bit of my money over a long period of time and then all at once. And that's what happens. I've seen it play out quite a number of times. So this is kind of some examples of how it plays out in real life so that people are forewarned and know, you know, how not to end up at that point where everything collapses very quickly. So the first one, let me see if I can just hide this so it's a bit easier to see. Yeah, there we go. So this is from the perspective of a research integrity officer. And within a university system, a research integrity officer is the person who has got overall responsibility for ensuring the integrity of the research that's done within that organization. So I was the named research integrity officer for the previous place that I worked. And this is an anonymized example. Some bits of it have been changed, so you would be able to identify it. And we followed the UK RIO guidelines that Kathleen flagged, so we had very well written standard operating procedures, so everybody knew exactly what should happen when there was an allegation of research misconduct. So this was a clinical pediatric study recruiting very sick kids admitted to hospital with sepsis in a low resource setting. And I received an allegation, not an anonymous allegation, but an allegation from somebody saying that they were really worried that somebody was making up data in this study. And you know, so that obviously raises alarm bells, first of all. So we started the UK RIO investigation process. And the first step of that is that myself and the rest of the research integrity team had some initial interviews with the people making the allegations to find out what the concern was. And it was of sufficient concern that we said, okay, we need to do an initial investigation here to gather some data. And the allegation was, and this was from one of the study investigators, was that a nurse in the team was fabricating data. And essentially that they had said that they'd examined some of the patients in the study and had written down some examination findings, but in fact that those examinations had never happened. The nurse had been making up data on these sick kids. So after those initial investigations with both the complainant and the respondent, that's the person making the complaint and the person who the allegation was being made against, we opened a formal full investigation. And that, like Kathleen said, took a long time. That's not something that's over in a week or two. I think this one took about 8 or 9 months in total to conclude and involved a substantial amount of work, including detailed interviews with all members of the study team. We requested all study documentation, including protocols, case record forms, laboratory results, all of this sort of stuff. And we also got an independent statistical review of the data that was being collected. And taking all of that together, the finding was that research misconduct, i.e. data fabrication, likely took place in this allegation. The reason we were able to say that is we had multiple corroborating witnesses saying that, you know, events that were suggested to have taken place and recorded in the study case records as having taken place never took place, and that there were statistical anomalies in the data, i.e. things like, let's say, blood pressure values were statistically implausible with far too many digits being recorded, so far too many 5s and 0s being recorded than you would expect by chance alone. And there was lots of other corroborating evidence as well. You will never know for certain that research misconduct, or very rarely know for certain that research misconduct has taken place. So you will likely see on the balance of probability, this is likely what's happened. And I think even more important than what happened was why it happened. And what happened here was very much as Kathleen outlined. There were multiple reasons. There was lack of training at multiple levels. This was an inexperienced investigator who hadn't really got experience of running studies on their own. The investigator was working under a very stressful environment, and the study nurse as well. You know, this is an extremely busy hospital with really sick young kids, a lot of whom were dying during the study. There was a real pressure to recruit patients to this study, coming from the investigator on site, but also from the sponsors and the team overseas as well. There was really, the data collection systems were not good enough. Essentially, they were taking handwritten notes and then transcribing them into tablets, so multiple weak points in the data collection system, and there were no systems really for quality assuring the data. And there were also really large cultural and power differential issues here as well. The investigator was from a UK university, whereas the study nurse was from a nursing background in a very poor country. And initially, there was a real reluctance from the study investigator to kind of assist the investigation process. There was I'm better than this doesn't happen in my studies, that sort of thing, until it all sort of fell apart, as I said. And so the consequences of this were pretty severe, actually. So there was a lot of detailed input institutionally to make sure that not just this study team, but study teams throughout the whole institute got more training in data collection systems, in auditing data and quality assurance, but also in management and leadership, how to appropriately manage studies. There were breaches of good clinical practice here. This is data falsification and human subjects. They were reported to the ethics committees and the universities of the parent universities who took further action against these individuals. The study data were never published. You know, these were really sick kids, valuable data that could have advanced understanding. And because there were such concerns about the integrity of the data, it couldn't be published anywhere. And as far as I know, it never has been. And there was huge, considerable emotional and professional aftermath for both the complainant and the respondent here. And again, things such as referral to the General Medical Council can happen. I'm not sure whether it actually happened in this one as well. But as part of your professional integrity, these sorts of things are considered. So I just want to pause and say this is kind of more towards the extreme end of the situation where a full investigation can happen, but it's not unusual. These happen in every university around the UK every week of the year. And like I say, don't get to the situation where small things look as though they're going wrong and you're not upfront and deal with them quickly. Be open, be transparent, and have systems in place upfront as well. The second one I want to discuss is from a different perspective, and this is from the perspective of a journal academic editor. So I'm an academic editor at PLOS Medicine, which is a great journal. Please submit your manuscripts there. And actually, they take research integrity very, very, very seriously. I think perhaps more than many other journals. And we've got a whole dedicated team of staff editors who do an initial screen on all submissions to say, is this ethical research? Does it fulfill our sort of criteria for high quality research that meets all of these integrity issues? So we had a paper submitted that was describing results of a diagnostic accuracy study. So this is a new test for diagnosing an infection. And it looked great. This came from a really good university, good team of authors, study results looking fantastic. We might consider this for publication. And the staff editor sent it to the academic editor. For me, yeah, this sounds great. Let's send it out for review. And we did. And we were lucky. This was a diligent academic reviewer who said, the sample size calculations here don't make sense to me. I can't replicate them. So we went back and we checked. and we said, please, can you provide the protocol for this study? And when we received the protocol, we found that there was no mention of sample size whatsoever in the protocol. So there was quite a lot of back and forward. And eventually it transpired that there would be no sample size calculations done for this study. Rather, they had written a paragraph in their manuscript to post hoc justify the sample size because they felt that it would be more likely to get a higher impact publication if they had a sample size calculation written. And this is falsification, right? You can't make up a sample size post hoc because you think it will lead to a better publication. So this was discussed at the editorial board meeting, and again, this is taken really, really seriously. Obviously, the manuscript was rejected. We're not going to accept something where we can't trust the basics of research integrity. There was a letter made to the local research ethics committee for this university as well about these researchers. I have no idea what the outcome of that was, but I would suspect that the University Research Ethics Committee would take it fairly seriously. And of course, internally at the journal sort of level, we take this a lot more seriously as well now, and changed procedures so that we require all studies to have their prospective protocols submitted up front with all versions, not just the most latest, the latest one. You want version 1, 2, 3, 4 with all of the versions that have changed between, as well as the statistical analysis plans. And honestly, if you want to get a good journal publication, doing this up front, submitting your protocols and your analysis plans will really endear you to journal editors. They'll think these guys are taking it seriously. We can trust the results of this research. And this is not an isolated example. Okay, I probably review about 1 or 2 articles per week for this, and there are a substantial number of them. There are some questions around authorship, data issues, falsification, and so you may think that you're able to push it past journal editors and staff editors, but we've seen pretty much everything that happens, and nearly all journals have as well. So again, be honest with yourself. The whole point of doing research is to advance knowledge. Don't try and cut corners to get better publications, because you will get found out eventually, and then it kind of goes along slowly and then collapses all of a sudden. So on that cheery note, and now I've absolutely terrified everybody, I'm going to stop. Just to emphasise, as Kathleen said, there is support available. And this can be at the planning stage. It can be proactive to say, what resources do you have available? I want to do this better. I want to learn more about it. We can point you in the direction of the resources. Or if you do have concerns, these are the ways to flag them as well. So thank you very much. And I think we're happy to take some questions.
Yeah,
right,
I think so, yeah. I'm just going to put this
oh yes,
well.
yeah, sorry.
I'm just
the
going to leave that up
well.
as well. So these are the links, and these are the safe contact volunteers, as well as Peter and myself as research integrity advisors. There's Kate, Helen Minnis, Vital, Asha, and Rona Strawbridge are all safe contacts within SHW to talk about anything, basically anything that any issues or advice that you want, or if there's any issues you want to discuss or report confidentially, you can contact any of these people.
I don't know how I can get the people online back.
Anyway, yeah, so if anyone has any questions, and I'll make a version of the slides available to people as well, so they can see all the links and access some of the stuff.
Go ahead.
Thank you for the presentation. I was interested in the fabrication.
Yes.
So I just wonder if the nurse would have needed the she fabricated the data, the process still in place, just certain it was.
So you might have to just repeat. Sorry, I didn't quite hear.
Yeah, I say in that scenario of fabrication.
Yeah.
I mean, it was established that the nurse fabricated the data. Like the nurse just said that she was guilty and fabricating the data, would the process still be in place to assert that she was guilty?
Yeah, because it's not just a blame issue, right?
Okay.
It's understanding why it happened to stop it happening in the future, or to improve systems. Yeah.
You don't say, yes, I did, sorry, but then the place is simply.
Absolutely, the investigation was still, and that nurse themselves may have been under a huge amount of pressure to put their hand up and say it was my fault. I'll take the blame for it, to cover for lots of other people. So it is really important that this process is done impartially with a whole panel of independent people to make sure that the truth is established, and that also systems are improved to stop this happening in the future. Yeah.
Thanks.
I have a question from the editor.
Yeah.
Like, do you actually also check the credit that actually they match the authorship?
Yes.
because in many journals, I'm not speaking about close medicine, but in many journals, you have to mention credit. And then even if you put something like editing review, which is clearly not enough, according also to some journal guidelines of what they mean to be an author. Actually, you can actually be named as an author.
Yeah.
So
I mean, obviously, I'm not an editor on other journals, and I don't know what everybody does. Certainly, from PLOS Medicine's perspective, we take this really seriously, and we do actually look and make sure that people meet all the criteria, and they have to sign and say that they do so before a paper is accepted as well. What I would say is there's a whole spectrum in journals, right? There are from the ones that take this really seriously and probably produce better, more reliable science as a consequence. And you will all be aware that there are hundreds and hundreds of journals out there that really just want to take your money and will publish anything. So part of being a scientist is picking your journals that kind of represent your ethos and the way that you work. And there are, if you publish things that are of less than the expected quality for research integrity, almost certainly it will flag at some point. I do a lot of systematic reviews and meta-analyses, so maybe I've done 30 or 40 or so. And so we're always trawling through people's papers in a variety of journals, and you find the most crazy sort of stuff happens. So you're like, that number is clearly made up. There's no way that number can be true. And so inevitably the team will go back to the authors and say, yeah, how did you get that number? Like, it's impossible. And then back and forth, we may go to the journal and say, come on guys, like, what's going on here? And so that the investigation may happen years and years after the paper was finished and published.
I think a question about plagiarism. So recently, one of the papers was presented because they say it was affected by plagiarism, and the full abstract was affected by plagiarism. But of course, it was like the abstract had been published in a conference proceeding. So that's why basically they use AI tools in order to detect plagiarism without having any kind of human check on the detection. So I mean, of course, because it happens just once, but then it didn't happen with other journals. So I was wondering if there is any kind of, I don't know, any kind of universally accepted across journal rule to say, okay, this is true plagiarism and this is not plagiarism.
I don't think there is, Manuela. I don't know how to answer that best, but again, I think that comes back to the self-plagiarism issue. Is that what you mean? So it was from your own abstract. So it's like that kind of self-plagiarism issue. So again, I think it's about flagging that up. I don't know whether that be in the letter to the editor, say, we've already this was presented and the abstract was published, but it was just as a poster conference abstract. That's the only place, because there is normally a tick box for has this ever appeared anywhere else. So again, it's that self-plagiarism thing where you're not saying that you can't publish it, but it's about acknowledging and thinking, because quite often you don't think, oh, I've published this, or my PhD student or one of my colleagues did this as an abstract. And actually many journals now publish the accepted abstract. It's self-plagiarism, but again, it's about not realising that you've done that. So and then that you've ticked that box, no, this is the first time this is to appear anywhere. So I think it's just about stopping and thinking rather than the rush to submit. That's probably the advice.
And it comes back to the journal as well, right? Journals that have actual human staff editors you'll be able to email them back and forth and say, listen, this is what's happened here, and have a conversation and resolve it. If you're submitting to a journal where they really just want to take your cash, I'm not saying that's what happened here, but you may run into more problems either at the point of submission or later down the line as well.
It's quite a good journal, and I had a very report with the editor, but still they say, you should have flagged this before. So it was quite strict.
Sure.
But again, I think it's just about thinking through what has been submitted. So it's that grey area with self-plagiarism. You could probably argue that no, it wasn't, but actually, if it was published, then
I mean, you may well have seen this stuff in the news in America, where there are groups of people deliberately setting out to find instances of self-plagiarism or plagiarism for very high-profile people, deans of Harvard Medical School and this sort of thing, and people trawl through what you've written and compare what you've written with the explicit aim of trying to discredit people who are perceived to hold particular political views. And we need to realize what the reality of the world out there is. You need to protect yourself against what might happen in the future.
Thanks for putting the fear of death into everybody there, Peter. So
Well,
I was just checking there was no questions online.
Yeah, cool. I think we've got time for one more, I think, before the end of the hour, if anybody has one. Wonderful.
Oh, you've scared everybody now.
Oh, no, I mean, what I would say, like, don't be scared. I love this sort of thing because it's really interesting. Yeah. And I think what it does do is it makes you a much better scientist because it makes you focus on the methods, on the transparency, on the high quality research, rather than just churning out another paper. So yeah, go slower, do better research, I would say. Yeah.
Thank you.
If anyone had any other ideas or suggestions for future research skills and development, please just get in touch with either myself and Debbie.